Thank you. Before I start, I just want to say we're hugely excited and pleased to have been awarded this, so thank you. And it's been just an amazingly uplifting day. So my name's Cathy White. I'm the Serco Cares Programme Manager. For those of you who don't know, Serco is an outsourcing company. So we provide facilities management services like portering, cleaning, ward hosts, security, help desk to 12 hospital sites across Scotland and England. But before I start, I just want to sort of ask you one question. If you or anyone close to you have been a patient in a hospital recently, which member of staff left a lasting memory on you? So I'm not going to ask you who it is, but just hold that thought until the end. So I might work for Serco, but what I would also really like you to think about is it's not about Serco. This is about support staff. It happens that we provide them, but we have a very ambitious and impressive managing director, I would say. His name's Ian Crichton. He used to be a very senior person within the NHS in Scotland, and the NHS is his passion. He joined Serco about 2 years ago, and he recognised that we have a group of staff that could potentially assist in delivering better health delivering better health outcomes. So how can our staff support the NHS, and how can we realise the potential of what they have, and they have a huge potential, but without impacting anything about what their job, the core part of their job, the cleaning, the ward hosts, the portering. We're very lucky because we have a part of an arm of Serco called Experience Lab. They're boffins, they're user-centred design experts. So Ian passed that challenge over to them, and that's how Serco Cares was born. What we want to be as an organisation is an organisation that wins jobs based on the fact that we care. We don't want to be the one that gets it because we're the cheapest. So Serco Cares is our way of making sure that we sing from the rooftops around how proud we are that our staff really genuinely care. Up here we've got a couple of things that I really want to point out. Social support and short-term interactions are linked to a positive mental attitude among patients. When patients feel positive, they get better quicker. Experience Lab, and we all know, and I suspect everyone in the room won't challenge the next point, clinical staff are under increasing pressure, and they perhaps feel they have less time to spend on the caring side of their role. Our staff sometimes are viewed by patients and visitors as slightly different and perhaps more accessible. So they don't necessarily always want to, what they see as, bother clinical staff with questions that they may feel aren't core to the nursing and the reason that the patient is in the bed. Someone also mentioned earlier today that if we've got happy staff, that generally equals happy patients. So if we can empower people and make sure that they are really happy in their roles, you can feel that. And feeling is a really important part of this whole programme. So we found we had a number of opportunities. I'm not going to spend too much time on those. You can read those yourself. So what is Serco Cares? It's about an emotional connection with working in healthcare. Some of our staff tell us they can earn more money working in a high street delivering pizzas or selling Cornish pasties in Greggs, but they choose not to. They are the type of people who like being in a healthcare environment because they enjoy the buzz, because they enjoy the nature of the business that they find themselves in. It's nothing about what they do, it's about how they choose to do it. But we know that our group of frontline staff, we needed to do something different. We needed to create a programme that wasn't seen as training. Because the minute you start talking about training, we get the statutory and mandatory training, we get what we call Serco Essentials about hand washing, how to push a trolley, all of which is really important, but we wanted to be seen as slightly separate to that. So we are really, really emphatic in delivering Serco Cares, that we call them workshops, we don't call them training. So what did we want to achieve? We wanted to make sure that our staff realised that they have a real opportunity to make an impact on patients. We wanted to celebrate the positive contribution that they make day to day. We wanted to have an opportunity to upskill them. All of this, as you can imagine, we've got people who've previously worked for the NHS. They may have worked for one of our competitors and we've then come in. Some of them have been there 20 years. Some of them that are natural communicators and they really get it. But then we've got others who are new joiners, perhaps, never worked in a healthcare environment. And we had to design a programme that fitted all those needs. So what is it? It's not customer care training. That's the first thing that we are very, very clear on. It's bespoke to a healthcare setting because that's what Experience Lab have delivered for us. We designed it very much as a partnership with co-design. Our people walked the wards, they wore the uniform, they talked to patients and visitors and carers, they talked to our managers, they talked to nurses, doctors, they got a whole feeling for what it was that this programme needed to deliver. So the emotional connection is vital. So what we actually have is a 20-minute film that we filmed in a Serco hospital, Mile End Hospital, and it follows the journey of a patient, and there are examples of particularly good practice of porters and cleaners. There are examples where perhaps they didn't get it right. But that is our way of pulling in our staff to the fact that to make them realise the environment they work in. We also bring out things like star stories. We've got some amazing stories that our staff have done. They've literally saved lives. They've made people feel significantly better. They've made difference to carers, visitors. All of that is absolutely relevant. And it's amazing when you're in the workshops that sometimes people don't necessarily recognise the value of what they're doing. And it's our role, and Tommy in the audience is one of our trainers, Claire is one of our facilitators. They do an amazing job at making people realise that they are really valuable. They are a valued part of the whole part of being in hospital. I don't know if any of you have seen or heard the JFK example of he was in NASA and there was someone cleaning the floors. And he said, "What do you do?" And he said, "Oh, I'm just a cleaner." And he said, "You're not just a cleaner. Nobody's just in anything. Everybody has a vital role to play in delivering whatever it is you're delivering." And that's one of the messages we're really emphatic on making sure that our staff realise. So in practice, it's 4.5 hours of staff off the shop floor. That's broken down into 3 separate parts. There's a half-hour briefing, they go away. There's a 2-hour workshop talking about the positivity and the power of positivity. We ask them to go away, reflect a little bit on what they've heard, and then they come back and they do the power to make a difference, which again is 2 hours. It's really different to anything they're used to, that they will have been through before. So, benefits. I've just seen the time, so I'm going to whiz through some of this, but there are benefits at all levels. We've got everything we do. Our philosophy is it's for the patient. So the benefits for the patient are massive, but we're really keen to get close to our clinical colleagues, because if we can be seen as one team at ward level, then that's when really good collaborative working happens. And it's not always the case. You know, we have wards in some of our hospitals where our staff are known as Serco. They don't know their names. They don't involve them in decisions. They don't involve them in meetings. And that's when the blame culture, there's a real opportunity to introduce blame, and we are absolutely not about that. So, achievements. We've put over 3,300 staff through the Serco Cares workshops, and that's based on with 2 trainers. So we've just got 2 people. We've delivered it to nearly 60% of our staff. The rest of this year is going to be delivering it to the rest of them. We've generated over 2,000 ideas, and what we then work on after the workshops is reviewing those ideas and seeing what we can do to make a difference and how we can introduce them. Some of them aren't in our gift. Some of them we need to work really closely with our NHS clients on. But we've had some very, very impressive outcomes, and I'm very happy. We're running out of time, but I'm very happy to talk to you about them afterwards. We've had a leading academic review it. This is a cultural change programme. It's almost impossible to measure the benefits because it's hearts and minds, it's behaviour. So we can't say there's a direct cause and effect, but all the feedback we get is looking very positive, and this is just in year 1. So, my call to action really is think about the role that non-clinical staff have in running the NHS. And very quickly, I suspect, in answer to the question I posed earlier on, is people in this room will probably almost definitely, some of them will almost definitely remember a porter or a cleaner or someone who just offered a very little bit of kindness that made a massive difference. And that's what Serco Cares is all about. Thank you.